My name is Charlene, and I'm going to talk about the main signs of damage to the peripheral nervous system. So, as we know, the peripheral nervous system is a network which consists of 43 pairs of motor and sensory nerves, like 12 pairs of cranial nerves and 31 pairs of spinal nerves. Mm. It just controls the function of sensation, movement, and the motor coordination. And they are fragile and they can be damaged very easily. So some of the injuries that we may have radial nerve injury, the peroneal nerve injury, the spinal accessory nerve injury, and also the femoral nerve injury. Next. So the radial nerve, it's the largest terminal branch of the brachial plexus. It originates from the posterior cord along with the auxiliary nerve. It carries fibers from ventral root of spinal nerves from the C5 to C8 and also the first segment of thoracic. They innervate motor function in sensory parts. For the motor parts, they innervate the muscle located in the posterior arm and the posterior forearm. And this innervates the three head of tricep brachii, which they act to extend the arm at the elbow. It also gives rise to branches that supply the brachioradialis and extensor carpi radialis longus, the muscles of the posterior forearm. And then a terminal branch of the radial nerves, the deep branch, innervates the remaining muscles of the posterior forearm. So these muscles, generally, they just act to extend at the wrist and finger joint, and they supinate the forearm. And for the sensory part, the lower lateral cutaneous nerve of the arm innervates the lateral aspect of the arm, the inferior to the insertion of the deltoid muscle. And then the posterior cutaneous nerve of the arm innervates the posterior surface of the arm. The posterior cutaneous nerve of the forearm innervates a strip of the skin down the middle of the posterior forearm. And then we have the fourth branch, which is the superficial branch. Sorry. It innervates the terminal division of the radial nerve. It innervates the dorsal surface of the lateral 3.5 digits and the associated area on the dorsum of the hand. So when there is damage of radial injury, it can be caused by like breaking the arm, like the fracture of the humerus, or maybe overusing your arms, maybe during sport or accident. So we have symptoms. If the fracture maybe it caused it's an area of the axilla, we have symptoms like weakness, tingling, or dampness of the back of the arm or the end. Dampness, we know it's the loss of sensation in some area of the body. And then if the injury happening to the spinal groove, we'll have weakness of the brachioradialis muscle of the forearm, and then also it will interfere with the person's ability to bend the wrist back or to straighten the fingers. And if the injury happened to the posterior enterosis of nerve, we have muscle weakness and also inability to extend the fingers. Next. Now we're going to talk about the peroneal nerve of the leg. It's one of the branches of sciatic nerve, which supplies the movement and sensation to the lower leg, foot, and toes. And then the nerve root is from the fourth segment of lumbar to the first one of sacral. It arises within lateral compartment of the leg between the fibularis longus muscle and the neck of the fibula. And the lateral, we have branches that goes and then innervates back. The lateral branch innervates the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and fibularis tertium. These muscles, they are responsible for dorsiflexion of the foot at the ankle joints during gait cycle of walking. Like dorsiflexion is like the flexion of the foot in the dorsal or upward direction, like when you are walking, like the action of raising the foot upward, like upward. And then they also innervate the two intrinsic muscle, and which is of muscle of the foot and the extensor digitorum brevis and extensor hallucis brevis. These muscles, they are responsible for extending the toes at the metatarsophalangeal joint and interphalangeal joint. Like in short, this muscle works in unison with other muscle to raise the toes of the ground. Like when you're walking, it's raising the toe. And then the medial branch, it innervates the skin of the, like the space between the first and the second toes. So when this nerve is damaged, maybe by like fracture, injury to the knee, fracture of the fibula, the bones of the lower leg. When it's damaged, we'll have this foot drop, like ability to raise foot is like lost, and we also have decreased sensation. We have painful sensation on the outer side of the lower leg and also in the top of the feet. Like this kind of, okay, next please. Oh yeah. And next we have the spinal accessory nerves. As we said, the peripheral nervous system include also the 12 pairs of cranial nerves. The spinal accessory is the 11th of the 12 cranial nerves, which originates in the brainstem. It allows two sets of muscle in the neck to function. The first one is sternocleidomastoid muscle, which allow the head to tilt and rotate, and also the trapezius muscle, which allowed for several motions such as shrugging the shoulder and moving the shoulder blade. Next. Okay, so when there's damage to this nerve that can be caused by trauma or damage during surgery, we'll have pulses of the accessory nerves. Like the most common cause is iatrogenic, meaning that it was caused by maybe medical treatment or by the surgeon, like during maybe surgical procedure, there's been a mistake or maybe damage. So the symptoms will have shoulder pain, we have weakness or atrophy of the trapezius muscle, and also we have partial paralysis of sternocleidomastoid, resulting in the inability to rotate the head or weakness in shrugging the shoulder. It can also result in asymmetrical neckline. The femoral nerve is the largest branch of the lumbar plexus. It's derived from the anterior hemi of nerve root L2, 3, and 4. So when it's innervating, we have the motor and sensory part. The motor innervates the anterior tight muscle that deflects the hip joints. We have the pectineus, iliacus, and then sartorius. And also innervate the muscle that extends the knee, which are the quadriceps femoris, like rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. And then the sensory part, it supplies the, like the anterior cutaneous branches of the femoral nerve supplies the cutaneous branches of the anterior medial side. And then we have the saphenous nerve, which supplies the medial side of the leg. So when there's damage, which can be also caused by like pressure, trauma, maybe entrapment of the nerve nearby caused by disease, we'll have some, we experience some symptoms. So damage of the saphenous nerves, maybe during procedure, maybe during surgical procedure, we can have pain, we have paresthesia or complete loss of sensation to the medial side of the lower leg. And some also signs and symptoms of femoral nerves include numbness or tingling of the leg. We have muscle weakness, muscle cramping, sharp and jabbing pain, difficulty walking or extending the knee due to the muscle weakness, atrophy, shrinking of the tight muscle, and also reduced sensation of touch. Thank you.